Thanks, Joe. Good morning, everyone, and welcome. Thank you for coming this morning. I'm Andrea Horwath. I'm the MPP for Hamilton Centre and critic for Children and Youth Services for the NDP, trying to fill big shoes left by my colleague Shelley Martel, particularly on the autism file. Beside me on my left is a person that some of you may have come into contact over the last little more than a week. Stefan Marinoiu is a gentleman who has been on a hunger strike here at Queen's Park. I believe today is his 9th day. And on my right is a gentleman named Bruce McIntosh, who has been active from a community perspective as a parent in the battle against this government, quite frankly, in terms of trying to get services for children with autism in the province of Ontario. So Stefan, we believe, has been forced to take these desperate measures of a hunger strike, frankly, because the Liberal government has not taken appropriate action. The Liberal government has failed to take the measures necessary to deliver on Dalton McGuinty's promise back in September of 2003, and part of that is what this poster board here is on the left, which was the promise that Dalton McGuinty made for autism treatment for all children in Ontario who require it, regardless of their age. At that time, parents were very hopeful here in Ontario. Now, they are frankly simply disillusioned. They're frustrated and downhearted over being betrayed and by the fact that Dalton McGuinty has betrayed their trust in terms of his promise to put together a system of services for these children. Stefan exemplifies the anguish that was brought on by government inaction and apparent indifference to children with autism here in Ontario. At a town hall meeting in about the middle of March, one phrase kept cropping up by parents. It was a huge town hall meeting in Markham. Both Minister Wynne and Minister Matthews were there. And parents after parent after parent used the term rotting on the vine to describe their children. It was a horrific and heartbreaking meeting. And parents had to, they were desperate. And their description of having to acknowledge that their children were not progressing, and that in fact many of their children were regressing because of lack of service it was a frightening evening. There's no doubt. Because the reality is, instead of real service, the McGuinty government is basically creating longer waiting lists. There's basically a traffic jam of children whose needs are not being met and whose potential diminishes every single week of waiting for the treatment that they need. In fact, just today, a new McMaster study has identified a breakthrough method of early detection of autism. What that should mean is that with the earlier detection, children can have services earlier. Intervention can be introduced quicker. This is what everyone says is necessary when it comes to autism. The sooner that you can get treatment to the children, the outcomes become much, much better for the kids. Now we have this new breakthrough. It's still to be, I guess, completely confirmed through peer review, but the reality is, how disappointing will it be if we can begin to assess at age 9 or 12 months that a child is going to develop autism and still not have the services available in the province of Ontario that are necessary to help that child develop into a full and contributing member of society. Instead, what we have is record numbers of children remaining untreated in the province of Ontario, languishing on the McGuinty wait lists without professional supports, without respite for families, without therapy that's available, that should be available in schools, and lacking provincial resources and follow-through. Stefan really is the face of parental anguish and sheer frustration here in Ontario. Minister Matthews took me aside actually a few days ago, or she actually called me because she was concerned about Stefan's health. She called me up and said, you know, you should really do something about this. He's on a hunger strike, and he's that's not a good thing. And I thought it was kind of ironic coming from the minister in charge of Ontario's autism mess, the minister who's, along with the Premier, the only one really that can stop this kind of anguish that Stefan is feeling, the only one who can actually take the action necessary to deal with the frustration that Stefan has with the situation he finds himself in with his son, who is now 15 and who has never ever had access to treatment and programs. And Stefan will talk to you about that a little bit on his own. The reality is, Minister Matthews could simply do what her leader and the Premier said that they were going to do in terms of ensuring children get the autism treatment that they need. But no amount of dancing on this pin is going to get around the commitment that McGuinty made to these parents. The McGuinty government spends millions and millions fighting parents in court instead of investing those millions of dollars into autism programs, into the development of a system that actually helps these kids and helps these families. So ignoring the situation simply makes the response a lot more difficult as time goes on for these kids. And again, Stefan will reflect on some of that himself in his remarks. But as I said earlier, the earlier the intervention, the better outcomes for the child, the more possibility, the greater possibility, in fact, the inevitability that they are going to grow to become, high-functioning, in many cases, contributing members of society. Not all, but many, many, many. Without the intervention, without the treatment, these kids really, they don't have a hope, and their parents go through so much frustration and so much difficulty and so much anguish. And you will see from the remarks of Bruce and others that parents are still bankrupting. They're still remortgaging their homes, selling their homes. I've got a couple of examples as well that I'm going to read into the kind of record, if you will, of parents who are simply, because they are unable to attain services, they're sitting parked on a wait list, their kids are sitting parked on a wait list, and so they do everything in their power to try to purchase services out of their own pocket. And that leads to huge financial pressures and, in fact, financial ruin for many of these families. So the message here, I think, isn't one that's difficult to understand. I don't think it could be more clear. Children with autism have to receive treatment at the earliest juncture. We've often said that it's something that should be funded out of OHIP. We fund all kinds of other programs for the well-being of children and adults through the OHIP system. Something that is medically necessary treatment, and it should be provided through OHIP. That is actually the purpose of publicly funded health care, is to provide the care that people need to maintain healthy lifestyles. So parents have made tremendous personal financial sacrifices, and we know that that's the case because the government hasn't had the time to put a plan in place in earnest in the province of Ontario, and it's been 5 years. I mean, it's not like this is something new. They spent, unfortunately, a great part of their mandate fighting these parents, fighting them through the courts, and they should have been focusing in on putting together a system that works for the families and for the children. I do have this the research tool document that's available. I don't think I have any copies here, but we can get some, and I know that you guys are good at finding all the information that comes out through the newswire, but McMaster University did provide that recent light in terms of possibilities of early diagnosis. I wanted to read you a couple of, and Bruce is going to expound upon some survey work that they've done and some information they've gathered from families of children with autism. But I thought I'd add a couple. I'd take a couple of excerpts out of these surveys and then turn it over to Bruce, because I think even though Stefan is here today and his hunger strike has been really to put a face on the issue and to kind of to raise awareness about the issue. Stefan is but one dad that reflects thousands of dads and mums across the province, and the anguishing situation that they are dealing with still 5 years after the promise of McGuinty to provide autism services to children of all ages. One person says, "There is an inequality of services for kids on the spectrum. My child, having milder autism, has a chance of contributing to society as a future taxpayer, and yet we get no assistance whatsoever and are left to scramble and pay through the nose with whatever we can get for our child." Another person says, "I'm very frustrated that my son was removed from his IBI program due to his age, and he was doing awesome in it, not only to be allowed back 3 years later. But what a waste of 3 years. I could not provide